Good morning, dear students. My name is Dr. Anand Srinivasan, and I am going to be your teacher for the Human Biology Semester 1. Okay, so in today's session, we will be seeing about the anatomy. What is anatomy? What are the different branches of anatomy? And what are the different terminologies we use in anatomy? Okay, so what is anatomy? So, anatomy is nothing but the study of the structure of the body. Okay, so you know that there are many structures in our body. So we are going to study about the structure, not the functions. Okay, just how do they look, the structure of the body and the physical relationships involved between the body systems. Okay, so what is their relation between one another? So that's the anatomy. There are many different branches of anatomy, like the gross, micro, embryology, radiology, surface, osteology, and neuroanatomy. So, what are these different branches of anatomy and what do they deal in each one of them? First, let's see about gross anatomy. Gross anatomy is also called as macroscopic anatomy. Okay, so that is the study of anatomy at macroscopic level. What is macroscopic? Macroscopic means that which we can see with our eye. Okay, we don't need any special instruments like microscopes. Okay, so the study of anatomy at macroscopic level. Okay, so we know that there are different structures. Okay, say for example, we know that this structure is aorta. Okay, so there are lungs, heart, okay, the abdomen, there are certain muscles, there are bones. So that is the structure which we see in our naked eye. Okay, so that's called as gross anatomy. The other anatomy, it's also called as microanatomy. Okay, microanatomy, or it's also called as histology. As the name indicates, so microanatomy means the study of the structures at microscopic level. Okay, so we are seeing the structures under a microscope. Okay, so that is called as microanatomy or histology. What is embryology? Embryology, or it's also called as developmental anatomy. Okay, developmental anatomy. So what do we study in this part of anatomy? The study of development from fertilization to fetus stage. So we know that when the human being is formed, okay, so the sperm and ova, they get fused with one another to form what is called as zygote. Okay, and after this fertilization takes place, slowly the cellular structures, they will be changing, going through different stages, and then finally the fetus is formed. Okay, so during these stages there are different developments. So how the heart is formed, how the eye is formed, how the limbs are formed. Okay, so how the face is formed. Okay, so we study about the individual structures, how they develop from the cellular structure. Okay, so that is the development from fertilization to fetus stage. So this is called as embryology or developmental anatomy. The next branch of anatomy is called as radiological anatomy. So what is this radiological anatomy? So here what we do is study of the structures using radiographs. So we know that there are many new techniques which have come in the health professional level. Okay, so we know that there are MRI scans, CT scans, ultrasound. So when you are seeing through an X-ray or a CT scan, we will be able to make out different structures. Okay, so for say for example, this is a bone. Okay, a particular bone. So this is the upper arm bone. These are the ribs. So we will be making out the different structures using a X-ray. Okay, using a radiograph like X-ray, CT scan, MRI. Okay, so this study of anatomical structures using a radiograph is called as radiological anatomy. Surface anatomy. What is the surface anatomy? The study of anatomical structures without dissection. Okay, without a dissection. That is, if we know, like if we ask a person like where is the heart, we will be able to say like this is the place where exactly the heart is located. Okay, say it is located in the left side of the chest between these ribs. Okay, between the second rib until the sixth rib. Okay, and from this part, okay, which is called as the sternum, from here to here. Okay, so we will be able to say where exactly the heart is located. Okay, similarly the lungs, where exactly the stomach, okay, we will be making out. Okay, so this is especially useful for surgeons. Surface anatomy is mainly useful for surgeons so that they know that where the organ is before they do the dissection. Okay, and also it is helpful in finding out the diagnosis. Okay, say for an example, a person coming with pain in the upper part of the abdomen. Okay, so you know the abdomen, right? So this is the upper part of the abdomen. So you should think like what are the structures present here? Okay, and if a person comes with the pain in this part, so what organs could be involved? Okay, so that's why. So we will be able to find out what are the structures which are present inside by looking at it from outside. Okay, without dissection. Okay, so in gross anatomy we do dissection. So here we don't do dissection. So the study of anatomical structures without dissection, it's called as surface anatomy. The next part of anatomy is called as osteology. Okay, osteology. So what is this osteology? Osteo means bones. Logy means study. Okay, so this is the study of bones. So there are many bones in our body. Okay, so we will be knowing like what is this bone. Okay, so each bones we will classify it by different names. Okay, what are the structures present in the bones? What are the muscles which are attached in the bones? Okay, so how does the bone look like? So all this we will be studying in this structures. Okay, so in osteology, which is the study of bone. Neuroanatomy. What is neuroanatomy? It is the study of the nervous system. Okay, the nerves. Okay, you know that the nervous system is composed of brain, spinal cord, and different nerves which are present in our body. So the study of this is called as neuroanatomy. Okay, neuroanatomy is the study of the nervous system, like brain, spinal cord. Okay, then these are the different branches of anatomy. Okay, now let's look into what is called as the anatomical position. What is this anatomical position? So anatomical position, see, when a person he can stand in different postures. Okay, so we are able to stand, sometimes sit, sleep. Okay, sometimes we will be sleeping up, or in a different position we will be running. Okay, or sometimes we will be, some persons they will be doing yoga. Okay, so the position varies. Okay, so when a person sits it's different. So in order to make a standard reference point, okay, we use what is called as anatomical position. So anatomical position is the standard reference point in which all positions, movements and planes are described. Okay, so this is the standard point. Okay, standard reference point. Okay, so what is this anatomical position? In an anatomical position the person should stand straight, erect. Okay, he should be standing erect. Body is upright. Okay, body is upright. Head is facing forwards. Head is facing forwards. Arms by the sides. Okay, so arms should not be away from the body. Okay, arms should be close to the body. Arms at the sides. This part of the hand it's called as palm. Okay, the palm should be facing anteriorly, okay, or forwards. Palms should be facing forwards, and the feet should be together. Okay, the feet should be together, okay, and should be touching the floor. So this is the normal anatomical position. So in the normal anatomical position, the person is standing erect, body upright, head facing forwards, arms by the side, palms facing forwards, and feet together. Okay, so this is the normal anatomical position. So using this anatomical position, we will be seeing different terminologies. Okay, so these terminologies, they are like A, B, C, or in an alphabet. So you know how do they form words, right? We form different words. So for which ABC is required. So similarly, before you start reading about anatomy, you need to know different terms. Now, what are these different? So before going to the different terms, we will see like what are the different planes. So when studying anatomy, we cut the anatomy, we cut the structures, we cut the human body. So there are different planes by which we cut the body to study the structures underneath. Okay, the first one is median plane. Median plane or sagittal plane. The spelling is very important. Okay, median and sagittal or sagittal. Okay, so the median or the sagittal plane is the one which passes exactly in the center of the human body. Okay, it passes exactly in the center of the human body and divides the body into right and left halves. Okay, so if you cut a person along the median plane, okay, so there will be a right half and a left half. So this is called as a median plane or a sagittal plane. The next one is coronal plane. Okay, coronal plane. So what is this coronal plane? The coronal plane, it's present between the anterior and posterior parts of the body. Okay, you know the anterior part, which is the head, okay, the eye, and posteriorly the back. Okay, so take this 2 point and exactly in the middle. Okay, so if you divide a person between the anterior and posterior, it is called as coronal plane. Okay, so if you dissect a person along the coronal plane, it will be divided into anterior and posterior. The next one is transverse plane. Okay, transverse plane. So transverse plane, it is passing horizontally. Okay, horizontally, dividing the body into upper and lower halves. Okay, upper half and lower half. So these are the three different anatomical planes: median or sagittal plane, coronal plane, transverse plane. Median plane dividing it into right and left halves, coronal plane dividing it into anterior and posterior, and transverse plane dividing it into upper and lower halves. Now let's see different terms. So here there are different terms which is mentioned: medial and lateral. What is medial? You know the section. Okay, so here as a part of a line which is passing exactly in the center of the body, okay, which is called as a median plane. Okay, which is called as the medial plane. Okay, if any structure it's closer to the median plane or midline of the body, okay, the part, any structure which is closer towards the midline, it's called as medial. Okay, look at the spelling: medial, M-E-D-I-A-L. Previously we have seen median, but here it is medial. Okay, medial. Okay, medial means it is closer to the body. Lateral means away from the midline. Okay, away from the midline. The next one is anterior. Anterior means the one which is present in the front. Okay, and posterior, it is the one which is present towards the back. Okay, so anterior means present towards the front and posterior means present towards the back. Okay, anterior is sometimes referred to as the ventral part and posterior is sometimes referred to as the dorsal part. So in this we have seen medial, lateral, anterior, posterior. Okay, so there will be different terminologies and initially it might be confusing, so you need to practice these different terms. Okay, start writing about these terms and ask yourself what are the meanings, what does it mean. Okay, the next term, superior and inferior. What is the meaning of superior? Superior means the structure which is closer towards the head, because in anatomical position we know that the head is in the superior portion. A structure which is present closer to the head is referred to as superior, and a structure which is present closer to the feet, it is referred to as inferior. Okay, superior, inferior. Okay, superior is closer to the head and inferior is closer to the foot. The next one, proximal and distal. This is especially with regard to the limbs. Okay, so we have four limbs. Okay, two upper limbs and two lower limbs. Proximal means the one which is closer to the body. Okay, this is called as the root of the limbs. Okay, the part of the body which is closer to the root of the limb. Okay, it's referred to as the proximal. The part of the body which is away from the root is referred to as distal. Okay, so distal means the part which is away from the root of the limb. Okay, distal. For example, the fingers are located distally, whereas the arm is located proximally. Okay, so this is called as proximal and distal. So we have seen medial, lateral, superior, inferior, anterior, posterior, proximal and distal. The next one is superficial and deep. Okay, superficial means the one which is present closer to the skin. Okay, the part which is present closer to the skin or the surface of the body, it's called as superficial. The part which is present away from the skin, it is referred to as the deep. Okay, superficial and deep. Okay, then different positions. What is the meaning of supine and prone? In supine position is the lying position, so in which the head faces towards the ceiling. Okay, the head is facing towards the ceiling. Okay, it's a lying position. Both supine and prone are lying positions, but in supine position the head is facing towards the ceiling, whereas in the prone position the head is facing towards the floor. Okay, so supine position, prone position. What is unilateral? Unilateral means one side, pertaining to one side. Bilateral means present on both sides. Okay, unilateral, bilateral. Okay, unilateral means one side, bilateral means present on both sides. Certain other anatomical movements. What is the meaning of flexion, extension? Flexion means bending a joint or decreasing the angle between two bones. Okay, so here these movements takes place particularly in a joint. Okay, so they take place in a joint. So flexion means this is flexion taking place at the elbow joint. So here you can see this part of the arm and forearm, the person is bending. Okay, so the angle is decreased, so this is called as flexion. Okay, the opposite action is extension. So flexion is decreasing the angle between two bones and extension is increasing the angle between the two bones. Okay, so this is flexion and extension of the elbow joint. Similarly, you know that there is flexion and extension of the shoulder joint as well, hip joint, knee joint. Okay, so there are different movements which are present in each joints. Okay, so in flexion and extension, it's usually present in shoulder, elbow, hip, and knee joints. The next one is adduction. Look at the spelling: adduction, abduction. Only one letter is different. Okay, adduction and abduction. Okay, adduction is moving the body part towards the midline. So here you can see the person is moving the limbs, the upper limb towards the midline. So this is referred to as adduction. Okay, abduction is just opposite, moving the body part away from the body. Okay, so this is taking place in which joint? The shoulder joint. Okay, so abduction, adduction. Okay, so abduction and adduction. Okay, abduction means moving away from the midline, and adduction means moving towards the midline. The next one is supination and pronation. What is supination and pronation? So the supination and pronation, they take place particularly in the radius and ulna. Okay, so they particularly take place in the radius and ulna. So what happens in supination? The arm, okay, so this is supination, the palm is facing up. Okay, so when the palm is facing up towards the ceiling, it's called as supination. When you turn the hand, okay, so now the palm is facing towards the floor, so this is called as pronation. Supination, okay, so where the palm of the hand, this is called as the palm, it is facing towards the ceiling, whereas if the palm is facing on the floor, it is called as pronation. So supination, pronation. Okay, the next one is opposition. Opposition. This is a particular movement which is present exclusively in human beings. So the movement of the thumb across the palm of the thumb. It's like pinch. Okay, like holding a pen. Okay, so this is called as opposition. Okay, so we are able to write. Okay, so we are able to write because of this movement, which is called as opposition. Okay, opposition. Okay, all right. The next one is rotation. Rotation means rotating along a single axis. For example, the neck. We are able to move from side to side. So this is called as rotation. Circumduction. What is the meaning of circumduction? Making a 360 degrees. Okay, say for example in the shoulder joint, we will be able to make a full circle. So that's called as circumduction. Medial rotation. Okay, so here you can see the person is closing, rotating the arm. Okay, rotating the arm towards the midline. So that's called as medial rotation. So this is medial rotation taking place in the shoulder joint. Okay, if it is rotating away from the midline, say here this is called as lateral rotation. So medial rotation, it's also called as internal rotation, and lateral rotation is also called as external rotation. Okay, so medial rotation, lateral rotation. Lateral flexion. So this is the particular movement which takes place in the spine. Okay, it is a particular movement which is taking place in the spine. Lateral flexion. Okay, so where they bend and the spine, where they bend the spine. The next movement is particularly taking place near the mandible. Okay, in the mandible, it's called as temporomandibular joint. Okay, so in this joint that is near the mouth, Okay, so it's possible to make this movement. So what is this called as? Protraction and retraction. Protraction means moving the mandible forward, and retraction is moving the mandible backwards. This is especially useful in chewing movement. Okay, in chewing, protraction forward and retraction backwards. And elevation and depression. Elevation is closing the mouth and depression is opening the mouth. So all these are taking place in the mandibular joint. Okay, the mandibular joint, or it is also referred to as temporomandibular joint. Okay, so protraction, retraction, elevation and depression, they take place in the temporomandibular joint. The other particular movement which takes place exclusively in the ankle joint, this is inversion, eversion, dorsiflexion and plantar flexion. So what is this inversion? Inversion is turning the sole of the foot inward. If we have seen palm, right? Palm is when the hand is facing forward. That is called as palm. The part where we stand, that is referred to as the sole. Okay, the sole of the foot, when it is turned inwards, it is called inversion. When it is turned outwards, it's called as eversion. Okay, so inversion and eversion. Okay, and similarly, when the ankle movements brings, when the foot is brought up towards the leg, it's called as dorsiflexion. And when it goes towards, like what is called, what happens in ballet dancers, so that's referred to as plantar flexion. So this movement is called as dorsiflexion, and this movement is referred to as plantar flexion. Dorsiflexion, plantar flexion. Okay, so those are the different terms, movements which we have seen. The next one is the regional terms. So in this we will be seeing the different parts of our body, but we use a medical terms, okay, with reference to the medical terms. Okay, because for a layman they will be giving different names, but when you are contacting your colleagues, a nurse or another health professional, okay, you need to talk in medical terms, so for which this terminology is important. Okay, so say for example, head. Okay, so for a layman he says the entire part is the head. Okay, so actually anatomically only this part is referred to as the head. Okay, this region it's referred to as forehead. Okay, the eye, this is referred to as the cheeks. Okay, mouth, this is referred to as the chin. Okay, so you need to be specific. For example, if a person says, like, I have a wound in the head, okay, you, when you're communicating with your friends, you need to tell exactly where the wound is. Okay, you need to say that the head, there is a wound in the forehead. Okay, there is a scar mark on the forehead. Similarly, you know what is shoulders. This part is called as arm. Okay, and here this fold, the armpit, it is also called as axilla. Okay, so this is called as antecubital. This is referred to as the forearm. Okay, the hip region, this is referred to as the wrist, the palm. Okay, and these are the fingers. This is the thigh, the knee, and leg. So here you can see leg is only below the knee until the ankle. Okay, so this part is referred to as the thigh. Okay, this part is referred to as the leg. This is the foot, and this part of the foot it's called as dorsum. Okay, it's referred to as the dorsum. The genital area, it is called as pubic region. Okay, this part is the pelvic region. Okay, this is the abdomen. Okay, the breast, this is the pectoral region. Okay, pectoral or the chest, and the midline, it is referred to as the sternal region. Okay, so these are the different regions of the body. Okay, so then it might be initially difficult, but you just close all these structures and then try to answer what are the different parts in our body. Okay, it comes by practice, so keep on practicing. Okay, so you hide these structures and then try to make out like what are the different parts in our body called. So this is the anterior structures which you have seen in the anterior, and here you can see what are the structures which are present in the posterior part. Mostly it is just the same except for a few changes. Okay, so here this part is called as the spinal column. Okay, the spinal column. This part is called as the gluteal region or the buttock region. Okay, the gluteal or the buttock region. This is called as the sacral region. Okay, this is referred to as the dorsum of the hand. Okay, the rest of them are almost the same. This is the heel. Okay, the back of the knee joint, it's called as popliteal. Okay, the back of the knee is referred to as popliteal. Okay, so these are the different regions which you need to know. Okay, so with this we come to the end